you need to understand the face. You need to understand the anatomy. You need to understand the rheology of products. And you need to understand the best possible techniques to get there. So what that means is that there's no shortcut, I will say, but there are great ways to launch. So the kind of didactic courses that we want to engulf ourselves in. So when people contact me every day, by the way, every day, like, Sarah, can I come shadow you? I'm like, shadowing me is not what you need. You can shadow me later. You can shadow my colleagues later. There's brilliant educators out there, but that's not your first step. Your first step is getting to know the intimacy of the face and the anatomy, or the body, if that's where you intend on working, aesthetically speaking.
Welcome to the American Med Spa Association podcast, Medical Spa Insider. This week, AmSpa President and CSO Cathy Christensen is speaking with Sarah Safa, PAC, top national aesthetic specialist, faculty for the Academy of Injection Anatomy, and founder of Refined Aesthetics.
Welcome to Medical Spa Insider. My name is Cathy Christensen. I'm the president and CSO of the American Med Spa Association, and I am very excited to be on a podcast today with a woman who I have known for several years, and I am inspired by her every time I talk to her. For those of you who don't know our guest, Sarah Safa, PAC, she's been in the industry in plastic and reconstructive surgery for 18 years now. She's a national aesthetic specialist, been known for non-surgical precision with laser treatments, advanced neuromodulator injections, and facial mapping. She's one of our AIA faculty, one of our amazing faculty for AIA. She's also one of our inaugural distinguished women of the industry. So please help me welcome Sarah Safa. Sarah, how are you?
Hi, Cathy. Thank you so much for having me. I greatly appreciate it.
I'm so happy to have you. How are things going this summer?
Things are going well. I think that, I've had a lot of growth with the practice and stuff, and all the things happening from a business standpoint. Thankfully, with AmSpa supporting me through some of this growth, I greatly appreciate it.
Always, you know us.
So the summer's been exciting, and things are starting to kind of just get in their groove. So I'm excited to be doing something near and dear to my heart, which is education.
Awesome. Well, we're going to pick your brain today because one of the things that we are always so grateful for is your amazing brain. And Sarah, you always kind of excel at making things that are complicated. That's a hint for today's topic, that are making things complicated more easy to understand. And at Medical Spa Show this past year, you and Julie Bass Kaplan did a talk on handling complications, which is unfortunately just a reality in the industry. I know I have had many conversations with many professionals. No matter how wonderful you are at what you do, they happen. But I imagine, and I'm obviously not a practitioner, but I imagine they are very, very scary, and it's easy to panic when things like that happen. So I know you did a talk at MSS. We're going to be picking your brain to get some of that knowledge out onto our podcast as well. So, tell us a little bit about your experience with complications, and even maybe like do you remember your first complication?
Oh my gosh, Cathy, I remember it like it was yesterday. But the funny thing is, at the time that it was actually happening about 15 years ago, I had no idea that I was actually creating a complication. So that's the scary part of it. It wasn't until years later, as we started to grow this wealth of knowledge and getting information, and the pharmaceutical companies getting on board with patient education and making sure practitioners knew what to look for, that I realized, oh my gosh, I occluded an artery.
Oh no.
So thankfully, with God's blessing, right? Things ended up being okay, but it was a simple injection. It was an injection in a very common area in the nasolabial fold. I am going to admit to you that I was using a non-reversible product, calcium hydroxylapatite. I thought the woman was literally a patient, by the way, who's still with me to this day. And I'm going to explain.
Oh, that's great.
I'm explaining to you why she's still with me in the end of this. But literally, I was injecting her fold. She had a little flash on her skin, and she was like, oh, that felt a little different. But I had mixed the product with a little lidocaine at the time, and we didn't think anything of it. And then a day or two later, she has a little bit of a herpetic outbreak of little lesions on her face. And I was like, oh, well, honey, I'll just put you on some Valtrax. She'll be fine. Little did I know I had the angular artery, right? Like, I had no idea that I had just partially or fully or whatever occluded an artery in her face, and how catastrophic that really could have been. I guess ignorance was bliss at the time, right? Because there was nothing, unfortunately, really to do proactively with that particular product. So sure, there were a few subsidiary things that could have helped her, but yeah, so it happened, and I didn't realize. And I think when I started realizing, oh my goodness, like every time I go into an educational seminar, every time I teach, even at the complications discussion on stage with you guys, I started off the discussion by saying, okay, raise your hand if you've ever had a complication. Okay, raise your other hand if you've ever helped someone through a complication. Pretty much. I mean, Cathy, how many people were in that auditorium? Hundreds?
Mm-hmm.
Literally 75% of that auditorium had their hand raised. However, the stats, if you will, right? It's like considered less than a 1% chance of an adverse reaction or complication occurring when it's done by a skilled professional on a healthy individual. But when you look at the reality in that room, that's not a real statistic. It's
Right.
not. So education, prevention strategies, how to be prepared, like understanding the anatomy, is a big part too why I joined, the Academy of Injections with you guys, because I really felt like we're missing the bar here. A lot of these trainings I'm going into, I would say, no kidding, maybe 2 out of 10 of the providers could actually take a marking pen and show me the vascular rich anatomy and the danger zones, and explain to me the different various levels of tissue planes. And now more than ever, we have this in our face because of people talking about it openly on social media and on platforms, good and bad, by the way, because we're not always getting accurate information.
True.
But I like that there's more awareness. And so likelihood would be that nowadays, at least if young Sarah is out there injecting and they create an occlusion, they're at least going to be aware with what it might be and can reach out for help if they need it. Although they themselves, I truly believe, there are no procedures that you should be doing if you don't know how to fix them, period. So I will stand high on that ground.
100%. So where does someone start? Because even if you've been in the hospital for 10 years, this is kind of a whole different technique and ball game that you're dealing with oftentimes. Even if you're trained as a nurse practitioner or a general practice physician, is your facial anatomy knowledge where it needs to be? I'm curious where you start, because there's so many people transitioning into this industry that have background, but is there enough there to get there? So I'm just kind of curious, what would be the ideal journey to get kind of comfortable and ready to have the safest, most complication-free experience as you possibly can, which is impossible, but still.
So I'm going to tell you my answer now versus what my answer might have been when I first started teaching almost 20 years ago. And that is, I used to think that you needed to develop your aesthetic eye to go into the aesthetic industry, to go into our specialty of care. I will now tell you, no, you need to understand the face. You need to understand the anatomy. You need to understand the rheology of products. And you need to understand the best possible techniques to get there. So what that means is that there's no shortcut, I will say, but there are great ways to launch. So the kind of didactic courses that we want to engulf ourselves in. So when people contact me every day, by the way, every day, like, Sarah, can I come shadow you? Sarah, I'm like, shadowing me is not what you need. You can shadow me later. You can shadow my colleagues later. There's brilliant educators out there, but that's not your first step. Your first step is getting to know the intimacy of the face and the anatomy, or the body, if that's where you intend on working, aesthetically speaking. And once you understand that body and the aging process and what you're really signing up for, what that means, and you have a full grasp on the medical side of it, then I think you can learn how to be a good injector, how you can learn to do a great consultation process. And I again, not to toot AmSpa's horn, I'm going to do it for a second.
Go ahead. I mean, we'll let you do that.
This comes from the heart, and I say this to anyone. I said this before I was a part with you guys and worked with you guys. I work with you guys because you offer that platform. You offer an opportunity where someone can come in and wholeheartedly get everything they need. And there are a lot of great educational platforms out there, especially for new providers and new injectors. But like, it gets difficult, and it's overwhelming, and it's complicated. And we don't want to deter other people from coming into aesthetics. Carl, I don't plan on doing this forever. Maybe part-time, but I don't plan on doing it forever. And we need great people to replace us. And there's such a demand for good care out there, and we need to strengthen that. So I would say, whether you're new or have been doing this for 5 years, or you're an expert 10-year plus person, we need to continue to refresh. And so if you can find a home like AmSpa, I'll just say it, that allows you to kind of access every single one of those courses you might need, whether it be business acumen or anatomy, it's good to have. It's good to have that connection. I think it's also good to make friends. I think it's good to make friends in the industry that are
Yes.
at various levels, right? And pick their brains and talk to them, because there's nothing like real world experience. Even in general medicine, what you learn in a book is not how you practice out there in real life. So I think shadowing experiences are wonderful, but getting to know the intimacy of aging and the anatomy first is quintessential,
Well, and
honestly.
even there is an importance too, and again, I'm not a practitioner, I'm not practicing, but I do hear a lot of stories. And talk about a little bit the importance of developing your network locally too, because I've heard a lot of instances where there have been complications where maybe you haven't had what you needed or had the knowledge or had the tool or whatever, and you had to reach out. Your saving grace was your network. Like, talk a little bit about that and how important it can be in these complication situations.
Do you know how they always say surround yourself by people smarter than you?
Yes.
That is exactly what your group of professionals around you should be. They should be your colleagues that perhaps even fill in some of your weaker knowledge areas, people that have more experience in
Yes.
trauma or an oculoplastic who deals with eyes, or your plastic surgeon who does rhinos in case somebody crazily decides to inject a nose. Don't do. You need to make sure that you are vetting your family of colleagues around you, but also not disincluding new people coming into your area. And we say in your area, but I would even reach out and say that nowadays it's been even easier, like for me to have the aesthetic mastermind group that I work with across the country, right, in all different states, and we all can work with each other even remotely to discuss complications and talk about things. So we are too far beyond nitpicking each other. Like, there's no
Mhm.
way we're going to grow as a specialty if we continue to think as our colleagues as competition. It's not going to work. It's not in the best interest of ourselves, these patients that we worked so hard and long to treat, and these practices, especially for mid-level providers like myself. We've worked really hard to be able to practice autonomously to some degree, right?
Right.
And if we don't continue to have a network of support, I think we're only weakening our chances of being successful and safe with our patients' outcomes. So there have been times, I mean, luckily I'm a bit of a hoarder when it comes to Hylenex. So people usually know they can call Refined Aesthetics, and I've got like more than I realize I have probably in the fridge.
Uh-huh.
And I would like to say thank you, Chris Zurich, because he scared the bejesus out of me one day when about it, he and Steve Weiner. So there's that. Um, but we cannot be ashamed to call each other when we need help. If we are providing a service that we know could perhaps have a complication outside of our realm of expertise,
Mhm.
we need to have that game plan set in place, so that it's almost like we've already rehearsed it. We already know exactly who we're going to call, and they know to expect our call if something happens. We got to take the shame out of the game. Like, things are
Yeah,
going to happen. They're going to happen.
100%.
Work is so helpful, Cathy. I'm glad you brought that up.
Yeah, no, I think even, I mean, the AIA faculty, which obviously includes you and the best, injectors that are in the industry, including Chris Zurich and Dr. Weiner, and they're very candid about, experiences that they've had too. So there's not anybody out there who practices regularly that's not running into things like, complications. And you're right. You can't bury your head in the sand and hope that it's not going to happen, or just kind of wish it away. So tell
Yeah.
me a little bit, like, what's the game plan? So if you're actually at a point where you find yourself in a situation like young Sarah did several years ago, right? We'll just say several years. And you realize something's going wrong. What kind of course of action do you take at that point?
Well, and we all joke about this, right? We're like, after you're done pooping your pants secretly, you've got to stay calm. You have to stay calm. You have to stay calm because, one, you'll be able to, because you're going to have that plan in place. And that is really part of that preventative strategy and measurements that we talk about. And I'm going to even I'll go back for just a minute too, Kathy.
Yes.
Before you get to that complication, preventative wise, like, we need to make sure we're putting our white coats back on. Like, we need to make sure that these preventative strategies that we are using beforehand, like appropriate patient selection. You know,
Mhm.
I think there's three things that are going to get you to that complication, and then I'm going to tell you what you do when it happens. So
Mhm.
three things I just want people to really mindful of, because I know our time is precious today, is it's no longer just, oh, that product did it. That product was bad. That no, these complications are multifactorial. Like it's going to be patient related. So whether or not the patient's a good historian, they're a good candidate, they're healthy, they're good at follow-up care, you know,
Mhm.
things like this is all part of that preventative strategies. Like we put our white coat on and we practice medicine. We make sure we screen these people appropriately. Two is going to come down to your technology, right? Like, are you using the right technology? Has your laser been calibrated in the last year? You know, do you have the right rheology of your filler product? Are you injecting in the right plane? You know, are you in a good mood that day? I don't know.
Yep.
Like literally, like are you ready to use that product right? So, and then also the technician themselves, right? The technician, like as providers, you know, do we have good technique? Are we on autopilot, or are we treating every single patient every single time they come in our office with a clear mind, right? And we're ready to go.
Mhm.
Are we communicating with our patients' expectations? I mean, are we continuing our education? Do we know what we're, you know, are we prepared for these changes? So those three factors, so that the technician or the provider themselves, the technology we're using, and the patient selection should help us mitigate those risks, should really help decrease this chance of this complication. But would, should, and if, when
Mhm.
you see it's going to happen,
Mhm.
you stay calm, you adequately tell your patient, it's okay, we have a plan for this, we know how to handle this. So if you can just relate to that patient in a time of fear when they're getting ready to go through those stages of grief and healing, because it's going to happen fast, you can literally mitigate half of their anxiety right away just by taking control of the situation and acknowledging it. And the two things I will tell people all the time, I'm sure Alex would love this with his lawyer wit, is that and I was an expert medical witness for a while, so I kind of got
Oh, okay.
one side of seeing what lands people in the courtroom, and honestly, it's very easy. It is time and communication. And that is why this patient is still with me today, because you have to act promptly when something happens. You can't put your head in the sand. You have to acknowledge it. Even if it's not, you can't wish it away. You've got to assume it is. And
Mhm.
if you annoy the crap out of your patient and they're like, I'm fine, I'm fine, I'm fine, and you don't think they are, you need to go with your gut instinct, right? So you've got to be quick and swift with time. Communication. I love this one. This is my analogy. I don't know if you heard this one. I always relate it to with communication. Of course, you've got to keep it throughout the entire event, and you've got to start right away with it. Whether or not you don't think you're over communicating, there's no such thing as over communicating with these patients when something is happening. But even afterwards, if you don't hear from that patient, it is no different than your toddler or your rowdy puppy being in another room, and all of a sudden you don't hear them. You know,
Uh-huh.
something's wrong. Okay, so if your patient does not like respond to your calls or doesn't call you back when you ask them to check in to make sure things are fine, you hound them until they call back. So because of those two things, time and communication, I did not know what was going on with that patient at the time, but I was with her the whole time through it. Like, okay, I've got Valtrex on board. Let's do this. Let's do a little bacitracin to heal up these wounds. Like, I never left her alone, even when I didn't know at the time what was going on. So there's no excuse to not have these two things, right? Even if you don't know exactly how to do it yourself, you can call someone else. You can't ignore
Mhm.
it. So staying calm, communication, acting in a timely way, calling on your colleagues if you need it. It might be, again, calling on a surgeon. It might be calling a friend that has an ultrasound device. So ultrasound is that new hot topic, right? And it is a exceptional tool for people, even people that are trying to learn their anatomy. I will say it is very helpful to have that ultrasound device to figure out what plane am I in? What does that look like? Oh, look, there are vessels going through there. Oh yeah, I remember seeing that in the cadaver lab. Like it is a great tool. And I think we keep talking about ultrasound units like they are a complication device. They're not.
Mhm.
An educational strategy. So we need to be a little bit more open-minded, myself too. Like I'm still in the mid-training with that stuff, and I want to only get better with it over time, because I think we're denying the inevitable if we keep shooing it away like it's not going to happen. But
Mhm.
why would we not use all these tools when things happen?
Mhm.
I'm trying to think if there's anything else I would do. I mean, obviously, each type of procedure we do has different types of complications.
Right.
We may not think it's a big deal, but to that patient and their livelihood and living and being presentable or client facing,
Mhm.
maybe works or jobs, like we can't ignore the fact that a little thing can be a big deal to them. So we need to treat everybody with care and compassion. And when they're trying to explain these things to us, when they're trying to say, hey, listen, like this and this and this bothers me. And we're like rolling our eyes in the back of our head because they have a bruise. This happened to me today, by the way. Okay.
Oh, really?
I injected a beautiful woman, her dearly, I've had her forever. She's had filler a million times, maybe not a million, that's exceptional, but she literally called me 2 hours later because she has a purple spot on her face. I'm like, okay, I know it's a bruise because I told her she was going to bruise because I thought, but I'm like, but what if it's not? Like, what if it's skin changes? What if it's something she's explaining it wrong? So I had to be very mindful in the way, kind of like your children practice that, mindfulness.
Yes.
Did it, and I had to take a deep breath and say, okay, what if it's not? And so
Right.
I think that we need to just make sure that we are not speaking over them, that we are taking an active listening position, letting them get it all out, making sure we're not missing something because we jumped the gun thinking, I already know what this is, don't say anything else. And I think that we need to just make sure that even if something bad happens, they also not only know that we have a plan to help them, but we have a plan B. And we should also have a plan B, by the way, because they want to know, well, if this doesn't work, what's going to happen next? I guarantee that's their next question for you. So it is a exhausting experience. But
no, but I feel like that's what makes medical aesthetics different, right? That's there, you actually have someone who's listening to you and cares about what you're saying. And, I certainly can't speak for all, medical doctors and nurse practitioners that I work with, but
not all Care Bears, Cathy.
I'm not saying y'all don't listen, but I'm kind of saying I've gotten the rolling eyes from like my kids' physicians and things like that. I'm like, no, but for real, like this is really happening. And
right.
No, but so I think that makes a difference. So that's what you're there for. And it's your, it's your face, it's your body. You've got to feel good about it. So I think I love to hear that you're like, kind of stopping yourself and being like, maybe.
We all do it. We're all guilty of it. What's funny is by the time I get home to my husband at night and or my kids, and they're like, you're not listening to me. I'm like, I've used all my listening today. Like, please do not ask me to listen.
I know that's what I do on the talking, like the words. I'm like, I'm out, which is so funny. It's like a man thing, but I run out.
This is why I love you guys though, because we have discussions like this, right? Like this stuff that you just kind of have to live to learn. And it just makes you realize how easy, not to downplay it, but still how easy the actual injecting part is, or how easy the treatment part is. So I think it was funny. My dearest best friend told me, who worked in the ER for years, and she said she dabbled in aesthetics a little while, for like a year or two. And she works in the ER in like trauma. And she goes, I don't know how you do it. I'm like, what? And she goes, I can't do it. I can't deal with all that. Like, it's so much. And I'm like, you deal with dying people daily and you can't deal with my needy patients. And she's like, I don't have it in me. You're a special person. I've had my psych PA rotation people, like friends of mine that I know, be like, wow, that's a lot of psych. And I'm like, so I think my biggest advice to individuals would be like, just take a deep breath and realize there is a lot to all of this. And so then when you heighten the situation with a complication, you just have to like either pop that beta blocker and relax, or you have to just understand, you have to have a plan. You have to, otherwise you'll sink your ship.
So what role does kind of informed consent and legal considerations play in all of this? As far as, I would almost think that would be kind of kick off the conversation with your patients on, hey, this could happen. This has happened. Tell me more about that.
Is Hermine Warren behind you? I mean,
no, but I did get a call from her today and I owe her, I need to call her back, but yes, no.
She's the queen and she has taught me so much in the years I have known her. I mean, things I thought were right were like not right. And she has definitely set me straight. Okay, well, the first part is it doesn't have to be scary. Like the consenting part of this, I think once you've done it and you just do it's not as scary or as intimidating to say, yes, there's a chance of adverse event. There's a chance of vascular occlusion. It could be laser. There's a chance of burns. There's a chance of scarring. I mean, it is our responsibility though to educate these patients prior and then just be mindful of reminding them when they come in for sequential treatment. So do I honestly go through the whole, Hermine's going to kill me. Do I go through the whole consent when I have a patient 2 weeks ago that came in for filler and she needs to top off these 2 weeks? No, but I do say, what has changed since last time I saw you? Now, the answers I get are absurd sometimes. I'm like, not your private life. Body with what we did, like what has changed, and that usually prompts into something specific I may need to know that can happen in 2 short weeks. Like, do you have any upcoming, procedures? Like, so I do go through the gamut of me, and it literally, Kat, it takes 2 minutes. It's not
Mhm.
it's not taking away financially from what we're doing. It's adding value. It's adding value and trust, which you can't put a dollar sign on. It can cost you a
Mhm.
lot of money later if you don't. But I always say it's easier to educate than to get to know someone's lawyer.
Yes. Oh, yes. 100%.
Just being honest, but right? Is it not? So let's just be mindful again of how we talk to our patients. Now, the one thing that I am trying to be big on right now with educating when I'm training providers is informed consent is of clear mind and body. The problem that we are having now is that there are a lot of little, I'm not going to say mommy's little helpers, because that was like back in the 50s or 60s,
Yeah.
but gummies, right? Like Pronut,
Uh-huh.
like anxiolytics. Like we are medicating or comforting our patients, or they're self-medicating and comforting. Like, oh, I had 2 glasses of wine with my girlfriend before I came in because I felt like a little nervous. If
Yes.
the patient says these things to you, you are no longer consenting them in clear mind. And so we have to understand, like, I am so sorry you scheduled this, but the fact that you're hiding vodka in your Sprite bottle, you can't do this procedure today because you just tried to set. I'm just kidding. That hasn't happened. I'm waiting for it. But the
I
fact
mean,
that
listen, I wouldn't be terribly surprised.
I'm just, I don't think it has.
I mean, I'm not judging. I'm just saying.
That's another part of consent that we have to actually ask them. So before
Mhm.
I waste my breath consenting someone before like a major laser or something, I literally like, have you taken anything today? Like, is there anything that you've used to relax? Is there any like, and they're like, well, I had a glass of wine last night. I'm like, that's fine. That's totally
Yeah.
fine. And I tell them, I prepare them when they come to see me for a consultation, when they go to plan the procedure, I will say to them, listen, you need to come in here ready to talk about everything again. Like, I try to tell them, like, be ready because I'm going to ask you these questions. So preparation, I think, is everything. You can't just assume they know these things. Even if they do laser once a year, you can't imagine they retain all this information. It's just too much. I can barely retain it all. So
Yes.
consenting is really important. And the other cool thing that we forget sometimes is what is considered a medical consultation. And I said this in our meeting, I think, too, when I was on the podium, is if you happen to run into your post laser patient in Costco 3 days later in the wine aisle, and they ask you, is this okay? Like, I have a little spot right here. Is it okay, Sarah? You are literally medically, you are doing a consultation with them. And you have to dictate that. Like, anytime
Mhm.
you talk to them, or if another colleague is, so when I'm dealing with complications with other colleagues of mine, if they have a patient of their own, I do not talk directly to the patient unless they are a patient of ours and they come to this practice. So I've seen sometimes colleagues of mine get on the phone a few times, not a lot, and actually converse with the patient to get questions answered. I'm like, don't do that. Don't do that. That's not your patient. Like you can give opinions or talk to your colleagues. But medical advice is when you're talking to that patient to any capacity. So be really careful about that too, because you run to him at the ball field. How's it
Mhm.
going, Sarah? Is it working okay? Guess what I get to do? Talk to Cindy again.
Yeah.
I mean, you gotta dictate. You gotta, I hate to say it, but cover your butt. You just
Mhm.
always think, what if, unfortunately, litigiously. And I hate that, but that's the world we live in.
But I think that is really good advice too, is because you really never know when it's going to turn, or you never know what's going to happen around the corner. So you just have to be as careful as you can. I was going to ask you, going back to kind of the
Yeah.
relaxation helpers that people use.
From the
Um,
patient. I'm kidding.
yes. So do you ever do you have any techniques that you send home with people, or that you help them, like breathing techniques or anything like that, to say, listen, I know
Yeah.
if you get nervous, you can't really do this. This doesn't really work if you're taking a gummy, but try
Yeah.
this or that. Is there any advice there or tips on how we could share that?
It's a great question, actually, and that's going to prompt me to think harder about that in the future for our practice. The thing I try to do, I think, because I overeducate, is I'm always available. Like, they know if they call,
Mhm.
someone's going to get their message, and I'm going to call them personally. I just don't ever want them to feel left alone.
Mhm.
And it could be the simplest procedure. Like it doesn't have to be anything major, but they just need to know, like, hey, not to feel abandoned. And I think that goes for the time period, like when you treat a patient all the way through recovery, because they can never feel abandoned. They have to know that, like, you are an integral part of their family now. And like, you're there to help them if something happens. As soon as you take on that responsibility with someone's care, that's on you. So
Yeah.
they used to always kill me here at the office. They're like, don't tell her to call whenever she calls 20 times a day. I'm like, but it's true. I can't not say it. It's like ingrained in me now. Like, call if you need anything, is what I say. Anything at all.
Yeah.
You right. Don't hesitate. And I think and they'll say to me, they'll get in my seat later and be like, gosh, I really had this one little bruise thing, but I knew it wasn't a big deal. And I know you said I could call though. So thank you. But I didn't think I needed to call. So it wasn't even the fact that they knew they could call me and it was okay. And I would be there for them. And I think sometimes we feel like speed dating, like boom, 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 done, right?
Yes.
Hands off, you're done. Like, or I don't know. I don't want to say wham
But
bam.
that's also the kind of stuff, that kind of like transparency and access that's the kind of thing that keeps someone coming back to you over and over again. And they feel safe. And then they're telling someone who tells them they look great, who do you go to? It's setting that precedent. I do think even though, it's funny because a lot of people think if you spend way too much time, which this is probably true, spend way too much time on consultation and time with patients, you're losing money. But in reality, there is a certain amount of like stickiness that you're creating too, from a business perspective too, that people are comfortable coming back to you and asking questions, and they get great results and
Yeah, yeah. I
some
think
love too.
the biggest compliment I can get, honestly, Kathy, which I love hearing, this is what like is food to my soul. Whenever I hear patients that are new to the practice come in with any of our girls, really, this is how we operate. We're huggers, right? We love
Yes.
patients overly sometimes. And the biggest compliment I can get is not go to Sarah, she's excellent, or she'll make you look beautiful or whatever. They always say go to Sarah because she'll take care of you.
Aw.
I'm like, that is to me the most valuable like response I could ever get from somebody talking about me to another person. Do you know that just really, that means I'm on the verge of doing something great, right? Like if they feel like we're taking care of them, that means a lot, right? That's more than, oh, she'll take your lines away. Oh, she'll
Right.
cheeks to make your lips look better, clean your skin. No, she will take care of you. And then they don't even really explain it, but they still come.
Yeah. Yes.
And
So
so
true.
say one thing I forgot to say, Kathy, which I think is really quintessential to this whole complication thing, is that when something happens, I think we were all raised, 20 years of me doing this now, I think that we were all brainwashed into thinking that like saying I'm sorry to a patient is confession of guilt. We have got to get over that. Like I can't stomach it when not a lot, but when I do see patients in this practice that their providers have refused care after treating them and something's happened, that it's how they handled it. And they never like even said, you don't, when you say you're sorry to someone, you don't have to say, I'm sorry, I jacked you up. Like it doesn't have to be like, I am sorry I created this. No, it can be, listen, I am so sorry that you are going through this while you're under our care. I am so sorry, but I want you to know that we are going to walk you through this entire practice. We are not going to leave your side. Like there are so many great ways to convey to someone, a human being, by the way, not just a patient, but a human being. Like
Mhm.
it's tough. Like we're going to go through this together, because I got to tell you, psychologically, we always talk about the physical aspects of these complications, but psychologically, everyone's world's about to possibly get rocked a little bit. And I'm not just saying
Mhm.
the patient, I'm not just saying us as providers, I'm saying even your support staff who's taking the phone
Uh-huh.
calls. Like it's going to be a psychological whirlwind, and guess what, it will die down, but only because we're going to hold hands and get through it together. And so
Mhm.
saying I'm sorry, I just want to make sure I say that enough. Like it's okay, it's how you say it that I think
Mhm.
makes people worry sometimes, but don't, and they'll be with you forever.
Well, I mean, I'll say that is one thing. I remember Alex and I like 100 years ago, and you could probably dig it up, but we did a podcast with malpractice attorneys, and
uh,
their biggest advice for everybody who might be in a situation where they have a complication or something is going around is just be nice. Like
yes,
the malpractice attorney said the best way to avoid a lawsuit truly is to just be nice, be kind, be human,
right.
um, and don't try to just ignore it or avoid it or what have you. But it was very interesting because these guys definitely have not made their living on being nice, but they said that's like the way you can fix things. So
if I were you, don't do what I say, not as I do. It's so valuable, and it seems silly that we even need to talk about that, isn't it? You would just think it'd be human nature, but when you take what we do so seriously, like this is
right.
our art, this is our work, this is our passion, this is for some of us over 2 decades worth of building this up. It's hard to not get a little defended when like somebody comes at you like, oh, you did something wrong, and
Uh-huh.
the thing you can do is make them feel crappy for talking to you about it. I mean, when patients are in the chair, I literally probably 30 times today, I said to them, listen, tell me everything, the good, the bad, the ugly, the great, the whatever. I want to hear it all. Like this is
Uh-huh.
first time patients. I don't take things personal. Your body is science. It is unique, and we're gonna figure out the code, but we have to do it together. And if you don't tell me things, I can't be the best provider for you. And immediately right off the bat, I kind of take that pressure off of them. Now, sometimes I wish I didn't say it to some of them. Like, you see a little wrinkle right there? And I actually don't see it, but I'm gonna go
Uh-huh.
here. So there's a little bit of that. You gotta give and take. But I do think that again, prevention and management, like we just have to get ahead of this stuff. It's how we handle things up front that can make complications so much easier later. And then, like you said, be gracious, be kind, be human. I'm gonna make it that shirt for you, Kath.
Yeah, but then I can't ever be in a bad mood if we do that.
We're gonna put it on Alex.
Yeah, but yes, like I could wear it after my coffee probably in the morning, but like, before maybe not.
Inside out, like no.
Yeah, right. Or I'll wear my hoodie like with my hood up.
I love it. That's great. No, this is, it's good. Active feedback, I think, from your patients is one of the biggest tools you can use. And if you practice active feedback, they even talk in staffing and offices about this speak up philosophy where you want to encourage your employees to speak up now. Um, our patients should be no different. Like if you listen to your patients and you actively listen to them truly, you're gonna hear a complication coming a mile down the road, which will probably help you decide what am I gonna do and what I'm not gonna do. Like there's no amount of money worth a complication. It'll cost you a lot more money later to fix. So we just need to slow down a little bit and listen to our patients truly and practice that active listening and being kind. We've got a lot of room to do. We all do for improvement in general.
Absolutely. And listening is very key. It's very, very important too. Because as you said, if you can actually pick up on clues that, could be important. I'm curious, as we kind of get near the end of the interview, tell me your ideal training or education path that you would do to at least go into kind of your higher level practice with injecting and doing it as safely and as kind of openly as possible, as far as just getting your technique down. Is there how would you start doing that? What's the most common complication that you have to be the most careful with? I know during the interview we're like liquid nose jobs, that could be a little bit tricky. Like I'm just curious, what would your ideal be? Because I know nothing is foolproof, but
right. Well, once I understand that, like for me, right, for instance, when I bring on new injectors here and we're training and providing them education or sending them out for education, anatomy is non-negotiable now for me. Like you are going to go to the cadaver lab, you are going to get intense anatomy training that's going to like probably blow your mind a little bit, because if I hand you a marking pen, which I don't pressure people, but if I did, I'd like to know that you know exactly the muscles, neurovascular anatomy, various planes, tissue depth. Like I said, like that is really important, because what we did 15, 20 years, 10 years ago, even, gosh, Kathy, we're so bad. We were injecting, you might as well put a blindfold on us. We were injecting blindly is what we were doing. So if you don't have an ultrasound unit and you don't know your plan, like you better, when you're looking at a face, like I feel like all I see is, this sounds horrible because of y'all, because the anatomy course now, right, with you guys, so many of them, I just see cadaver head. Like I see, and people are like, you're weird. I'm like, no, it's just, just like this different dimension now when I look at the face. And we've had so many people come through that course. Like
Yep.
Academy for Injection Anatomy, and their experience are like, I did not process this until just now, what I've been doing to people. And that is scary. So
Uh-huh.
definitely you got to know your anatomy first, right? Then
Mhm.
I think it's important to jump into um, getting to know products, right? Like if you're going to do, so I think neuromodulators are honestly the easiest thing to start off with, quite frankly. So learning the neuromodulators, learning muscle placement, movement, dynamic movement and strain, that is super low risk. Like the worst thing you're usually doing with your Botox is creating an unsatisfactory result, right? Now, the key and quintessential part here is that you better know how to fix it.
Yeah.
So if something happens, there are so many off-label areas that you might need to go to advanced courses for neuromodulators, right? Find a course outside because, or have a really good provider that can help instruct you in the office or teach you, whether you go through Allergan, Revance, Galderma, whoever, whether, go through the beginner's course, like AmSpa has, Hermine and I know George do a nice job with the starter
Mhm.
class, going over those basics, which we all glimpse over sometimes because we've been doing it so long, we forget how important those courses are. Those beginner type courses are going to just set you up for success. Are they going to make you a master injector? No. Like in my
Mhm.
opinion, you're not a master injector until not only have you done it 1,000 times, but you've done it perfect 1,000 times.
Mhm.
Then we get to claim that master injection thing, right? And so I do think that neuromodulator, safe way to go. Then I would step into skincare, obviously, kind of comes along with all this stuff. You kind of hold it hand in hand. You cannot, in my opinion, be a great aesthetic provider if you don't understand the balance of someone's skin and their tissue envelope and making it match what you're doing from an injector standpoint, non-surgically speaking. So you need to kind of start gaining that balance, that knowledge base of information about therapeutic skincare lines. Like, now we're going into biorejuvenation, like
Yes.
everything is now like collagen stimulation and natural and regenesis. And I'm working a lot now with Area Essence, which is kind of cool, like growth factors. So we're in that world now. So actually, the kind of cool thing is these people that are coming in new are coming in at such a dynamic movement where things are all about
Yes.
just natural and regeneration and using stimulation with the body. It's such a cool time that all of us old people are like, whoa, what's happening? Can we keep up? So growth factors, PRP, PRF, exosomes, all of it, right? So they're going to be fine because they're right there with us. So those kind of courses have to happen on the side. So then you're going to get into your injectable fillers. That's where you better know your anatomy because that's where real problems can happen, right? Vascular occlusions, nodular formations, infection, again, unsatisfactory results. But the scary ones are the ones that can be more permanent, like, blindness and things. So taking an ultrasound course, getting to understand, if something happens, can I identify where to go and how to reverse this? So talking about complication panels and a lot of our big conferences, like your big old one that you guys always have, right? Med Law show,
Mhm.
so many different speakers just talking about this real life, real day that we can't do sometimes when we're speaking for companies.
Mhm.
That's the kind of stuff that newer providers need to get out and experience because you don't get that alone. And a lot
Mhm.
of new med spas really are kind of opening quickly, and they don't always have veteran injectors there helping these newer injectors. So they really need to build out that community and go to some of these shows to get a better grasp on things. And then last but not least, I would say laser technology, light therapy, laser
Mhm.
technology, radio frequency, skin stimulation. That usually is kind of the last piece of the puzzle that most people can probably incorporate with their education. And most amazing laser companies will offer that education to them as well and bring it to them and help teach them. So it's all out there, but it's very intimidating how to get there. So, and you're going to be investing a little money in yourself, but that's okay. It's just like you did in your education for undergrad or to get your medical license. It's be ready to invest a little money because it will pay off if you do it the right way. And it's not free.
Absolutely. Well, and I mean, would you agree that you kind of get what you pay for a lot of times in this industry too?
Yes.
Yeah.
You want to get CME for it because it is your time. And if the education is valuable enough that you like will get something out of it, most likely it's got CME attached to it,
Right.
usually. Because that means whoever is hosting that conference, that medical show, has it to get the medical, they have gotten the approval because it's that good material. So I have
Mhm.
to think about that factor too.
Yeah, absolutely. Well, before I let you go, one other kind of aspect of this that I've heard a lot about is when a complication is to kind of the level of severity, that means you have to take it to the next level, go to an ER, go to a hospital. And a lot of times the ER has no clue how to handle these things. What is your advice for that? I know Yvonne Delos is someone who educates a lot on kind of having a crash kit for emergency rooms so they understand what's going on. Is there, do you have any advice on how to work with your local hospitals, or if there's anything that you can do to make sure that safety net exists for patients in your area as well?
Yeah, and I will say we are fortunate in our area in Loudoun County where some of our plastic surgeons have taken it upon themselves to educate. When it's funny, I feel like they've done it when they've been on a call for an emergency.
Yeah.
Hey, by the way,
Yeah.
the like hyaluronidase needs to be here. Like you guys need to have this. So it is interesting to me that a lot of my patients actually I've made them understand that you need to call me. Like if this is related to something that I did, I do want to be involved right away before you like, if you feel like you need to go to the ER, that's fine, but I better be that phone call and the ambulance. Like I better be the first one you call because we are so far away from, unfortunately, emergency medicine quite understanding, although we've grown exponentially, right? In this, they are really far away. So, but they're very receptive. They are so respected. Every ER, I treat a lot of the hospital people here in the office, and they are all actually curious and receptive. So I think it's silly for us to think that they don't want to know. I think it's different for them, and it's kind of foo-foo. They're like, oh, you have an enzyme for that? Like they wish they had enzymes like we have enzymes, right? So I do think that I've actually had the ER call me one time because they could not get in contact with the provider, and legally they shouldn't have called me. It wasn't my patient, but they were just kind of like, hey, are we on the right track?
Yeah.
And I give them my guidance on that. And it wasn't a huge complication. It was a small vascular occlusion of a lip. But I was able to actually get in touch with their provider pretty quickly for them through outside source. So discussions with your local ER is important, but what's more important in my opinion is having that crash kit, like having the tools you need in your office ready to go. That's part of that plan that we talked about. Having providers numbers that you are the oculoplastic, your plastic surgeon that you might need to call if there's anything about tissue monitoring or reconstruction that might be done later. Have it on a little card. And mine's upstairs right now, but it's got a card on it with the names, the numbers, what to look for. It's eye wash stuff. It's, it is, we don't do the nitropase and stuff as much, but it's the medications that we need. It's the steroids that we need. It's the hyaluronidase that we need. It's the needles that we would need to pull it up versus me rummaging in my drawer and trying to
I was just going to ask you that, like, what is in your crash kit?
Packs. Yeah. Heat packs are in there. We have a massage gun in case fatigue massaging. I mean, we've got the medications we need. We've got the tools we need, the syringes. We have the phone numbers and contact lists we need. So it's all in one little kit. That's it. And you can also buy these kits. I don't want to necessarily, I'm trying to remember the name. Oh gosh, we actually it was a wonderful lecture that you guys gave that I listened to. And do you remember the name? She was
it was Yvonne Delos. She's
Yvonne, she's got everything in her little beauty kit. And it's so cute too. It doesn't even look like a crash kit. Yvonne, she did a great job. I know she's very close with Julie Bass Kaplan too, right? They have helped kind of figure out this kit, but who cares, you guys? Like it's the same thing we say about hyaluronidase. People are so cheap and they don't want to buy stuff. But the best insurance policy you will ever have is if you got to throw something away that expired because you never had to use it.
Right.
Win-win.
Right. 100%. Well, and plus, I mean, I'm sure in that moment when you're in the middle of a complication, you would pay way more than you're losing to have that like at your fingertips.
Yeah. And again, now that we have extra tools, we have to kind of revamp. Like we've got the EO2 patches that we have the contact number for EO2 concepts. Like there are people that are going to come in with the oxygen patches if you need that for vascular necrosis. This is actually a big topic I know we discuss at the cadaver lab for the complication discussion. Like, we kind of give very direct answers. I know we're in a short period of time here, but there are so many new, latest, greatest things that we can be doing for our patients to help them during complications that you've got to stay up to date on this stuff. You have to stay up to date on this stuff, if not a little more than even your technique and new products available on the market. You've got to have the complication discussion for your patient safety, or you shouldn't be doing it, truly.
Absolutely.
Yeah. So anyway, I can run over this stuff forever, Cathy.
I know, I feel like I could too, but we are probably getting to the point where we have to say goodbye to you. But I am very lucky that I get to see you in July in Houston, which it's July. So like in a couple weeks, actually. I feel like I haven't seen you in forever.
Forever.
But then we have you in New York in September, Nashville in October, and Orlando in November for the Academy for Injection Anatomy Advanced Cadaver Labs, which are amazing. If you'd like to join us, we'd love to have you. You can find out more at americanmedspa.org under training. Go to injector training and you can register and work with Sarah, and I'll be there, and Dr. Surik and Hermine and everybody else. So you can check that first step off the complications by learning your anatomy. So, well, thank you, Sarah, for your time today. It was amazing. And you're, as always, just an incredible wealth of knowledge. So thanks so much.
Miss you guys. See you soon. Bye, everybody.
Bye.
Thank you for watching the Medical Spa Insider podcast. Please make sure to subscribe to our channel for future videos and podcasts. For more information about the American Med Spa Association, please check our description below.